Medical Dilemma.
Hi, welcome back to Medical Dilemma. We are here on our second episode, and thankfully we have our host, Attorney Sara Suguitan,
Hi, good afternoon, Father.
and Attorney Dr. Sanchez. Okay. So we will be continuing with our discussion about this very exciting, very interesting elective surgery. And we have with us here our expert in surgery, Dr. Gozali. Dr. Gozali,
Yes.
there are certainly some issues that sometimes we face when we do this elective surgery.
Yes.
And what is usually the reason why doctors agree to elective surgery?
No, first, of course, we identify the disease, the problem. Now, once we identify it, we discuss with the patient because then if the treatment option is surgical management, then that's the time we discuss the approach in the surgical manner for the case. Now, we call it as an elective because we have time to discuss. Again, as mentioned earlier, in emergency cases, usually we are called in the middle of the night or even from the emergency room, things like that. We have no time to discuss. Okay, therefore, in these elective cases, we discuss what was the finding, what was the plan, and what is expected out of the plan. Remember, the treatment is not cure-all. So, again, we as a doctor, if we cannot cure, but we do not harm them as well.
That's right.
So, therefore, there are cases, especially in cancer cases, let's say it's a stage 4 disease, but the patient had an obstruction, right? So we still have discussed the time with the family and the patients, but there are certain instances we cannot do anything. Remember, there's a such things of they call open close.
Yes.
Parang frozen na
Right,
lahat
these
ng
are
nasa
frozen
loob.
things that we really have to do something, at least to alleviate the suffering of the patient, right?
The bulking also.
Yes,
maybe,
yes.
And remove as much as possible.
Right.
Pero kung minsan, frozen nga, no? You
Yes,
cannot identify
yes,
anymore the
yes.
anatomy.
Right.
Oh, yeah.
Earlier, doctor,
Yes.
we were discussing something about the mastectomy, no?
Yes.
Where, for example, the right breast has been removed, but the left is still very much healthy. No?
Right.
Now, there is fear that probably the other left breast will
Yeah.
also be infected or will also be diseased.
In the future,
So
maybe.
how do you approach this,
Okay.
doctor?
I think this become an open understanding in the general public because of the Angelina Jolie issue.
That's right, that's right.
So,
It comes to mind.
Right. But remember, in dealing with breast cancer in particular, there is what they call a sporadic and an hereditary. Sporadic meaning you have no family history, the patient is the first to have breast cancer. Now, in hereditary breast cancer, then you will see that the relative or close, let's say the mother and the sister has a breast cancer, and our patient now has breast cancer. Then you start suspecting this maybe is a hereditary type.
Right.
All right.
Right.
Now, what happened, in order to answer your question, Father, they call it a risk-reducing mastectomy. The diseased breast is will be treated either by breast conservation or by mastectomy. But the issue is what will happen to the opposite breast. The opposite breast is normal at the moment, right? There is a criteria for that in order to be able for the doctor to perform that kind of surgery on the supposedly normal
Supposed to be
breast.
normal. Oh, okay.
Like one, as I mentioned earlier, if you have a hereditary breast cancer syndrome, it's more known as the SBOC. So meaning hereditary breast and ovarian cancer syndrome. There is a test for that. That's what happened with Angelina Jolie. She subjected herself for the cancer genes identification. They call it the BRCA1 and BRCA2. So if she has, then that patient has a particular risk of developing breast cancer before, well, it's varied from books to books, but
That's right,
generally
that's right.
around 70% of that patient will develop breast cancer before the age of 70 years old. So, okay, so as you grow older, you increase the risk. One of the strategy to prevent that is prophylactic mastectomy, which is the risk reduction mastectomy.
It means that you don't have to remove the other.
Yes, therefore, in some hospital, when the patient requested the doctor for that, we have to put it into an ethics review.
Right.
Okay.
We
In
do
some
that at Makati
hospital,
Med. We do that.
Yeah, but there is no written rules. It's just a matter of you wish, yes. If not, as long as. But if the patient has that kind of like BRCA1, BRCA2,
Right.
it's in the book. So the surgeon is justified to do it.
Perform
Probably the risk there is the fact that if it is something genetic, something like that,
Yes.
then you might as well subject all the other relatives for an examination.
Right,
Otherwise,
right.
they will also be at risk.
Yeah, but
And that is precisely where sometimes the ethical aspect would come in. Why? And not everybody will develop such cancer after all.
yeah. So that kind of prophylactic mastectomy is defined provided that that kind of data is presented by the patient. So there's no issue because it's scientifically proven. Now, but patient who does not have that kind of information and just by a mere request, I just want to have it removed. So that is the dilemma for the
That's a
doctors.
dilemma for doctors, no?
Yes. Yes.
And well, sometimes also the affordability would come in, the financial implication would
Correct,
come in.
correct.
And usually, as we know, only the rich can subject themselves to do that kind of procedure for that matter. Because for the average, I don't care because I don't have it yet.
Right.
So sometimes the medical dilemma is based on who can pay, who may not pay.
Right.
That's sometimes the problem.
Yes, yes.
That's a
So
very good point.
it's not a dogmatic decision has to be made. It's still variable, depends on circumstances, as Father has said.
Right. Yes,
I
Dr.
think
Sara.
there should be no problem if you know that you have cancer in one side of the breast,
okay.
no? But if they're both negative, like in the case of Angelina Jolie, she has no
Yes.
cancer yet, right?
But even
Also,
though
what is the opinion, Father?
one breast is diseased, breast
Ito, hindi-
cancer, again,
Sometimes.
is an ethical issue. Why remove the normal breast? Because remember, we have to submit that to the laboratory.
That's right.
And the laboratory will say normal breast. So why did you,
So there will be some controversy there,
Right.
and then
Yeah.
the doctor might be sanctioned or something like that because it's
Yes.
normal.
Yes.
Why are you doing this? No?
Right.
In one case we had at Makati Med, no, the couple themselves
Yes.
went to us, no,
Right.
consulted, because sabi nila, this is just to save also in cost. Nandun na
Yes.
rin lang, and aside from that, she gets worried, no, that it might
Yes.
spread, because the incidence of spread to the other breast is how much?
Well,
More or
if
less, how long?
the chances of the normal breast is going to have a cancer
Yes.
in the future is different books to books. But in general, it's around 2% per year.
Per year.
It's
Per year.
2%.
Yes,
Per
meaning some books said it's 15% the next 5 years. Okay. The only thing is, depends if it's a ductal or lobular carcinoma. Okay. Lobular has a tendency to have a bilateral breast cancer. So higher in
Higher in likelihood.
likelihood. Now the issue is people is Are you in the 15% in the 5 years, or you are the 85%? We
You
don't
wouldn't know. Oh, yeah.
Right.
And
So-
the 15%, these are, as they say, is evidence-based.
Yes.
But it's actually
Yes.
not the real thing.
Right.
Because you can either be in the 15 or on the others, or 85%.
Correct.
You'll never know.
You will never know.
And that is why there is an ethical aspect if you remove the other one.
Yes.
Just because of that fear for that
Yes.
matter.
Right.
And because of that fear, you cannot anymore live
Right.
happily the way you should
Yes.
because of that fear.
Right.
And that is precisely where the problem is.
Right. Right.
And I think one of the significant things that you have said, Doctor, is prophylactic procedure.
Yes.
If you have such a procedure, why not take advantage of it?
Right.
Rather than, well, subject
Wait for-
yourself immediately for that
Yeah.
procedure.
Metastasis.
And then,
Yeah, that's why, Father, if you look the previous editions of surgical books, they call it prophylactic, so to prevent.
prevent,
Now, the correct term is they call risk-reducing surgery. So, you are not preventing, because remember, even though you remove everything,
you just reduce.
meaning you probably free of cancer of that breast is probably what, 90-95%. That is no 100%.
That's right.
So how about in the skin? When you take it out, there is probably some remaining breast tissue remains. The bulk of the breast tissue was removed, but how about things like that? So that's why, and many now we call it risk reducing. We decrease the risk, but we did not prevent totally.
That's a good
Yes,
information.
yes. There's a new
Right.
It's the new approach
something
now.
that probably our audience will be able to
Correct.
learn.
Yeah.
Because these are new things that before it's just like this
that's
or
the
like
new
that.
development.
But the new development tells us quite a different story for that matter.
Yes.
And that's the reason why we invite doctors like you with experts' opinion about this to also educate the people.
Yes, Father.
To remove those old paradigms which are not anymore relevant today.
Opo.
That is why this is very important as far as our audience is concerned.
Thank you, Father.
For this matter, for cancer or any other kind of procedure for that matter. Even for those which are administered or done by plastic surgery surgeons, those cosmetic surgery, which are most likely are elective surgeries, for example. No?
Right.
And you know very well also the legal problems that will come later on.
Yes.
And many doctors have been hurled into
Yes.
to the courts because
Yes,
it has become botched.
Right.
Especially this plastic surgery, and they did not like what happened, something like that.
Right.
And Doctor, I heard you before na for a doctor to be hurled into the court
Yes.
is bad enough.
Oh, yeah.
We don't anticipate things like that.
That's right. That's right. It's bad enough. That's
Of
right.
course.
Yeah, I'd like,
Attorney.
I'd like to ask Doctor, kasi before the show, Father and I were discussing cesarean operation.
Cesarean
surgery.
Okay.
Is that an elective surgery? I mean, or is it both an emergency and an elective procedure?
Well, it can be an elective surgery, but then you need the consent of the couple, and then if they insist, that's another dilemma, because most obstetricians, like we had our guest in the past, say no, we will not do it unless there's an indication to do cesarean section. Yet sometimes ang reason lang nila natatakot sila. They don't want to go into labor, which in itself is also traumatic sometimes, no? And pwede rin may mangyari sa normal delivery. It's not, you're also after mortality, morbidity. Sometimes may nangyayari rin. It's not a joke to be delivering for or to go into labor for hours and everything. Yes. Meron din, there's also risk to the child, to the baby going out,
Yes,
Sometimes okay, fetal heartbeat paglabas. Wala na, and that's nobody's fault. It's because they waited too long maybe or something. Or there's something in the pelvis of the woman and the descent, see?
So the norm is still normal delivery and
yeah, but if there's a reasonable explanation, I think, by the mother, why she wants or she opts to have a cesarean section, probably
then
can
you'll
be.
proceed with
Probably,
cesarean,
yes.
exactly.
Well,
Kanya-kanya.
among the elective surgeries, doctor, that you have
Yes.
performed, which one is the most difficult so far? That you can figure out?
you know, it's really, uh, there is a standard that you probably expect. For example, appendicitis, when you perform appendectomy, you are expected to finish it within an hour, for example.
Okay, okay.
But patient A, patient C, patient C are not the same. So
Okay.
sometimes you get surprises, difficult, you know, it appears to be easy, but it can last hours. So meaning, like the same, like gallbladder, for example. You know, again, that we used to tell our patient until now that this is the average period of time that we will spend for the surgery. But you pray and I pray. So make things it hopefully, you know, shorter and expect. But sometimes you get surprises.
Right.
So there's no really specific, especially in the surgical procedures.
Certainly, this is also a good information for those of us who are watching there, no?
Yes.
That every patient, if you would
It's
agree, is a
individualized.
different case.
Yes, correct.
And no matter
Father.
how probably similar the cases are,
Right.
every patient is different from one another.
Correct, Father.
And that is the reason why people should already be educated na, well, if ever this case is applied to this patient,
Yes,
it is not always the same.
correct.
Because there are so many people who say, pareho lang naman sila, bakit nangyari sa
That's
aking
correct.
pasyente?
Correct.
That's true.
So you
Anything
cannot
can
compare
happen.
the cost, Father,
Yeah.
also, no?
The amount of difficulty probably.
Right,
That is why the
yes.
cost becomes also very expensive because of
Correct.
the amount of difficulty
Yes.
and the longer you are in the
Yes.
operating room,
Yes.
there's so many ancillary materials that you are going
Yes.
to need, etc., etc. So it makes surgery very expensive.
Yes. And I just want to add, Father, sometimes in difficult cases, we surgeon, the attending surgeon, sometimes needs help. Okay, and we do that, call our colleague who are either more expert
Yeah.
or they are highly specialized to assist to do the surgery together. And in that case, generally, the attending surgeon should inform the family
That's right.
that we have to call this surgeon. Don't do ghost surgery. Because some, they
Yeah, we heard
invite not
something about the
informing the family,
Yeah.
you know, there is a second surgeon comes in. No, I think that is not correct. So I personally, I inform, I go out,
Right.
inform the family, this is difficult case, and so the family will feel at ease. And, you know, so at the end, is the patient is our priority, the
That's
safety. Yeah.
Truly, it's a very important information for the patients to know or their families to know who are the ones going to treat him.
Correct.
And as a matter of fact, it is a part of the principle of informed consent.
Yes.
That we do not only tell the patient about his diagnosis, the treatment, the prognosis, or the financial implication,
Yes.
but also the people who will be responsible as far as the treatment is concerned. We are up for our second segment, and we'll come back for our last segment. Don't go away.
Medical Dilemma.